You look down a microscope and you see a cell with Rockstar Hair. Your first thought is, that's cool, and your next is, oh, that's not right. What you are looking at is a lymphocyte with cytoplasmic projections.
But Stephanie, just say hairy cell leukemia.
Well, even though in school you were taught that only hairy cell leukemia has the Rockstar Hair, there is another possibility, but more about that later. For now, let's focus on hairy cell leukemia, or HCL. HCL is a B-cell neoplasm with a higher incidence in males than females at a ratio of 7:1 in some texts, and in others 4:1. The median age is 50 years and patients usually present with splenomegaly but lack lymphadenopathy. There is typically bone marrow involvement, therefore patients with HCL usually present with pancytopenia, which means their white cell, red cell, and platelet counts are low. Patients will typically have both neutropenia and monocytopenia, which means these patients are at a higher risk for infections. If HCL is suspected, you should carefully examine the lymphocytes, but since patients typically have a low white count, this will be a hard task. In my opinion, you should examine cells carefully for any patient, but most diseases are never usually suspected. Most diseases and disorders are found incidentally, so always be on the lookout. But I digress. Hairy cells are mature lymphocytes that have a characteristic appearance of abundant pale staining cytoplasm with cytoplasmic projections around the circumference. The nucleus is usually oval with fine chromatin and tend to lack nucleoli. However, just because you see the cytoplasmic projections, don't only think it will be hairy cell leukemia. There is a chance it could be splenic marginal zone lymphoma. These cells also have projections but tend to be on the polar ends of the cells instead of all around. But you never know. Biology is rarely 100%. So when I see cells with Rockstar Hair, I will usually only say cytoplasmic projections and won't back either horse until confirmatory tests have been performed. Diagnosis for HCL is typically done via flow cytometry. If a bone marrow is performed, HCL patients tend to have marrow fibrosis, which leads to a dry tap, where obtaining bone marrow aspirate is difficult. If special staining is done, the cells in HCL show acid phosphatase staining after tartrate incubation in the tartrate-resistant acid phosphatase or TRAP test. HCL is considered a low-grade lymphoproliferative disorder. There are several treatments for HCL available, and patients can typically expect more than a median of 10 years of survival relapse-free after initial chemotherapy. Some cases, however, may require splenectomy. And now you know about hairy cell leukemia and that there is a possible doppelganger in splenic marginal zone lymphoma. Check out this video here to keep going on your hematology journey. Subscribe for future videos and give a like if this type of video works for you. Thank you for watching. Until next time.